On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to another spotlight session on lung cancer. The session is brought to you by the IHW Council and supported by Roche. I'm your host, Dr. Behjat, and today we will be delving into the topic, Let's Talk Lung Cancer, Understanding the Risk Factors, Treatment and Prevention. And to discuss about this very pertinent health topic, I have with me Dr. Nikhil S. Ghadial Patil. He is the Senior Consultant Medical Oncologist and Hemato-Oncologist at Yashoda Hospitals, Somajipura. Welcome to the discussion, Dr. Nikhil. I think you are on mute, sir.
Yeah.
Welcome to the discussion.
Thank you. Thank you so much. Thank you for having me here. It's indeed a pleasure and privilege to be amongst you. And I hope we have some wonderful discussion as we go forward. Thank you.
Thank you for the time, Dr. Nikhil. Coming to, the topic which we are talking about, lung cancer, which is, a very critical health issue. And when we talk about the, overview and the impact that it has on your body, we'll start with the types of lung cancer to give an overview of, of the different type of lung cancer, how it impacts your body. We'll start with that so that our viewers, our listeners get to know more about the topic.
Okay, so before we start and dwell more about the types of lung cancer, let me just try and brief about what happens when a cancer forms in the body, because it is equally important, especially for the audience, because this is some question which most of my patients also ask. Doctor, how do you really define or what cancer is all about? So basically, as we understand, the body is made up of cells and which are arranged in a very structured manner, which eventually form organs. Now, whenever in the body, these cells, they change their structures because of their genetic alterations or whatever it is, or various other factors, these cells lose their regulation. And when that happens, these cells start increasing in size in number in a very haphazard manner. Eventually, they form small clusters of cells, which are called as tumors, which are evident on various scans and all that. And eventually, these cells also develop a capacity or a tendency to spread to various organs. So that, in nutshell, is all about what cancer is all about. Now, when the same thing happens in the organ, which is like lung. Now, when you talk about lungs, lungs are basically structures which are in our chest, and they are like two structures on two sides. So anytime the same thing happens in the lungs, so any abnormal, uncontrolled growth or proliferation of cells which starts in the lung and spreads, that is typically what is called as lung cancer. Now, coming to the type of lung cancer, now this is more of, I would say, a discussion which is normally done by the pathologists, and this is more of a scientific discussion. In general, the lung cancer has multiple types, but just to make people understand, when the tumor or the sample is taken from the lung tumor and which is seen under the microscope, then it can typically, by the pathologist, it is labeled as either a small cell lung cancer or non-small cell lung cancer. Now, this depends on the type or the way these cells look like under the microscope. Now, every type, again, the non-small cell again has various subtypes, but I think that is more of a theoretical discussion. But this is just to give a brief understanding. The small cell lung cancer are more aggressive, they are less common, and the non-small cell lung cancer are more commonly seen in today's era, and they are slightly slow, and they have got more treatment options which are available with us.
Nikhil. So before we move to the risk factors associated with, I would like to know, like, are there some symptoms or signs that, common people should be wary of when we talk about lung cancer? Like you have very, explicitly talked about the two kinds of lung cancers. And so when we talk about, because people, especially Indians, they, in cancer is detected at a very late stage. which makes it difficult, to respond positively to the treatment modalities. So when we talk about, are there some signs or symptoms that people at certain age, in certain group, because next we would be coming to the risk factors, but what are some of those signs, if if you could just enlighten our audience on that?
So that is quite important to understand what are the important symptoms of lung cancer. Now, just to give a brief background, there was a time, especially during the COVID times, we came across some very early stage lung cancers who never showed any symptoms. Just because they underwent scan for various infections and you could pick it up. So when you talk about the spectrum of symptoms of lung cancer, it starts from almost being asymptomatic, which usually can happen in a very early stage. But that is not something which is very common what we see in day-to-day practice. Unfortunately, for whatever reason, the lung cancer symptoms are like quite similar to various infections or various other lung issues. So at times it's quite challenging to really say or really dogmatically tell you that, oh, these are related to lung cancer symptoms. Having said that, there are certain symptoms which are commonly associated with lung cancer, and the first and foremost remains the chronic cough. Typically, these patients do complain of cough for some time, after they go to the physician, they take some medications, come back. Sometimes they feel good. Again, they go back just to tell the doctor that somehow they are not getting relieved of this particular symptom. So this is one of the cardinal symptoms of lung cancer. So how I tell my patients, or sometimes the relatives who ask me, doctor, how would I know that whether I'm battling with the cancer and how quickly I can pick up that disease? What should I do? So I normally tell all my patients and their relatives, in case if you have someone who is having any symptom which is lasting for more than 2 or 3 weeks or not subsiding despite taking treatment, it is better to seek a physician's help, a pulmonologist's help, get yourself checked, scanned, tested, x-rayed, and then we can take it forward from there. So this is one of the main symptoms, which is cough, which is not responding to simple normal over-the-counter medications. In addition, the other symptoms include, at times the shortness of breath as the patient, while the patient is doing day-to-day activity. At times there can be a chest pain. Sometimes some patients do present to us with coughing out of bit of a blood in the cough, or what we call as blood streaked sputum. That is also once in a while we see or we come across. At times the patient do complain of difficulty in swallowing, where sometimes because of the pressure of one of the masses on the food pipes, the patient do complain like that. Not only that, there are times the patient do complain of unexplained weight loss, extreme fatigue. These are the common symptoms what we come across. Although you might make out that there are certain symptoms which are quite non-specific, but there are certain symptoms like, what I mentioned about cough, chest pain, breathlessness. And at times there are some patients who present with some lumps or bumps in the neck, and that also can harbinger and a cancer within, but just that that how we normally start evaluating and eventually reach a diagnosis.
Right, Dr. Nikhil. So you have talked about the symptoms that people should be, wary of, but then there are symptoms which are common for other infections as well. Coming to the most important part, which, we have to talk about, which is the risk factors, because when we talk about cancer, especially lung cancer, there are a lot of myths, related with different types of cancer. It is a very dreaded word when we talk about the normal, thing, how normal patients and a population take that. So when we talk about the risk factors, people say, "Arey, main to smoke nahi karta tha, but still I got diagnosed with." So there are a lot of myths and misconceptions that are related with that. So when we talk about the risk factors, what do you have to say on that?
You are absolutely spot on when you say that what are the real lot of patients do come across and who tell us that, doc, we didn't have a single risk, any bad habits in our lifetime, and what would be the reason why we got this cancer. And many a times we probably may not have answer for it. But at the same time, let me first explain what are the common causes or common risk factors for lung cancer. And if you really want to enlist the common causes, the first and foremost remains smoking. The second remains smoking, and the third also remains smoking. So I can tell you it is that important or that bigger risk factor when we talk about lung cancer. If you really ask me what is the percent of patient or what is the how many patients normally get lung cancer due to smoking, I would say almost 8 on 10 or sometimes almost 9 on 10 lung cancer patients would have history of smoking, which might be an active smoking, or there will be substantial number of patients who might have smoked in the past and might have abandoned or stopped in the recent times. That can happen. But so smoking remains the first and foremost important risk factor. So this is what we call as active smoking, that somebody who smokes and gets a cancer. And there is something what is known as passive smoking, where you are exposed to the smoke which is done by one of your friends or colleagues, and you are unfortunately you are in the same environment and you continue to get that exposure for a long time. So that is called as passive smoking, or also known as second-hand smoking. So these are the important risk factors. In addition, there are other risk factors which probably we all are part of. Unfortunately, we cannot get away, and I'm sure our friends and colleagues from Delhi can tell you more about it when it talk about pollution, and it's something which we all get exposed on day-to-day basis. And air pollution remains an important risk factor. It's as simple as that. If you are continued to be in the more polluted environment for a long time, that becomes a constant insult to our lung tissue or lung cells, and eventually the cells undergo changes, damage, transformation, and eventually lead to cancer. In addition, certain exposure to radiations, either due to treatments or for whatever other reasons. Then there are certain exposures like radon, and there are certain factory workers. Like if you look at certain people from cement factories or some glass factories, where you are exposed to asbestos and some other heavy metals like chromium, cadmium, etc. I mean, honestly, these are the something which has been described. But asbestos is something which we often see in our patients exposure in certain parts of the country, like more in Rajasthan, where you actually see more patients coming from the exposure, and certain cancers are more often in that part of the world. So these are typical reasons how I mean, it can happen. In addition, there are certain genes which run in the families. It can be sometimes be genetic, although for lung cancer it is quite uncommon. So these are the, I would say, the important risk factors when it comes to lung cancer.
Right, Dr. Nikhil. So you have explicitly talked about two, three of my questions you took in that, because when we talk about, risk factors, how pollution in Delhi, of course, smoking is a primary risk factor, but then there are other reasons like occupational hazards, like you talked about workers in, certain factories that may have an aggravated risk of developing lung cancer. So when we talk about, prevention, because cancer though is not typically a, lifestyle disease in that sense, but are there some lifestyle interventions that can, go to a certain extent in limiting, that risk of developing cancer? Is it true? Like, can we have developed that kind of a preventive lifestyle? Because when we talk about prevention, what are the important things that you would want the viewers to be, to take into account?
So again, when we talk about risk factors, and at the same time we also talk about the ways to prevent the cancer, we can say that they are kind of two sides of the coin, how the way you have to look at it. Now, as we understand, the first and foremost reasons for getting lung cancer remains smoking. So whether it's a smoking, either active smoking or passive smoking, so that is the first thing. I'm somebody who is already smoking. I think there is, I mean, it's not, you don't need a doctor to tell you to stop it. I think this is how a society should be. I think society is aware of it. It's just that despite knowing all the issues related to that, still there is, there are always those addictions and all those psychological issues which play into mind of many people. So that is something which we all know. So first and foremost, when you talk about lifestyle modification, first is to kick the butt. You have to really stop smoking. That is the first thing. In addition, there are, as I mentioned, when you are working in a certain environments, like, with a highly polluted areas, and the places where you have more exposure to air pollution or certain heavy materials like, or metals like cadmium or sometimes asbestos. It is a responsibility not only for the individual but also for the various offices, organizations, to take into consideration how they can limit the exposure of, let's say, for radiation, for that reason, for a matter, asbestos or cadmium. Are we doing a regular checks, and how we can safeguard our employees in order to mitigate the risk as far as the cancer is concerned. That is second part of. And the importance of healthy lifestyle, when we talk about regular exercise, we talk about a healthy diet, cannot be overemphasized over here. It is quite important that not only for lung cancer in general, but for all the cancers, when you talk about, these are quite important. If you maintain a healthy weight, you have a good balanced diet, good protein rich diet, and not too much on the red meat. Although red meat is not directly associated with lung cancer, but when you talk about lifestyle modifications, these are quite important things. So exercise, good diet, optimum weight, and this can also help the patients reduce the risk of not only for lung cancer, but for a matter other cancers also.
Dr. Nikhil, very rightly you have pointed out that how these small lifestyle interventions can go a long way, not only for lung cancer or cancer for that matter, but many other non-communicable diseases when we talk about other diseases as such. Coming to lung cancer, because, when we talk about the treatment options, how would you describe in a very precise manner when we talk about treatment options once somebody is diagnosed with lung cancer? What is the next step? How are those treatment options and other things, how do you go ahead from there?
So I think when you ask this question, probably I would try to break it into two parts. Maybe I would talk more about the management, and when I say management, it is more from the diagnosis as well as the treatment part of it. So like it happens with almost all the cancers, that the cancers are staged, like whether it's a early stage, late stage, or intermediate stage. So first and foremost, when you get a patient who is suspecting a cancer, more often than not, we come across a patient with a scan, or we normally advise a scan, which is either in the form of a CT scan or a PET scan, just to stage the patient. And we also need a confirmation of diagnosis, which is typically done by a small process called as a biopsy procedure, which is typically for the lung cancer, where a small needle is inserted into the area, into the chest wall, and try to hit the tumor if possible, or any other accessible area. Sometimes the patient do present with some kind of fluid collection, so we kind of tend to take out that sample from that fluid and try and confirm the diagnosis. So once we see the cells under the microscope, which is done by the pathologist, we confirm the cancer's diagnosis, and the staging is typically done by a scan, which is in the form of CT scan or PET scan. Now, the cancer treatment is divided into three areas, I can say. So one is depending on the stage of the patient. Secondly, depending upon the symptoms of the patient. And thirdly, what are the treatment options which are available? Now, in general, the early stage lung cancer are treated with surgical intervention, where you find a disease which is in a very localized, very small area, where surgeons probably feel that they can remove it completely, and that is the best way forward, and that gives you extremely high cure rates. And whenever the cancer usually comes with the intermediate stage, where there is some kind of a local spread, but no spread in the any other part of the organ, that is called as loco-regional disease, means some cancer in the lungs and sometimes in the nodes, or what is called the immediate draining areas. That is typically done by the multimodality of treatment. So when I say multimodality, it can be surgery and radiation, it can be chemotherapy and radiation, It can be chemotherapy, radiation, and immunotherapy. So there are various options, permutations, but this all depends the doctors, the treating consultants or treating physicians, oncologists take a call about what is the best possible management for that particular individual. And in a patient who is actually, so there are occasions, as you initially you asked me, there are times the symptoms are not very much evident for many lung cancer patients. And there is the case of a patient who presents to us in a very advanced stage, which is typically stage 4, where the cancer has spread to other organs of the body. These are the patients where they are typically treated with more of a treatment. Now, there are various new forms which are available, like in the form of some chemotherapies or something called as targeted therapy or precision oncology. And the newest kid on the block remains immunotherapy. So these are the patients who are typically treated with one of these three options in general, so as to maximize their survival. So early stage, mainly surgical option, late stage, mainly, chemos and immunos, and somewhere in between it remains a mixed bag where you on one side you might require a surgery, on other side you may require radiation, and to potentiate the responses you might use chemotherapy or immunotherapy in addition.
Dr. Nikhil, you have very, in a very nice manner, you have explained the treatment options in lesser number of words. And I hope the audience will take a lot of relevant, information there. When we talk about since you've talked about the treatment options, so you think counseling forms an important part in the overall, management, because like you talked about at a late stage, patients are coming when you talk about targeted therapies, precision oncology. You think in the overall journey of the patient, how important is patient counseling? Because, like you said, people have your patients must be having a lot of questions. Why me? And things like that. So do you think emotional support, psychological counseling is an important part of the overall management?
So let me put it this way. The counseling is as important as the treatment of the patient. And, it again, as I mentioned previously, it cannot be overemphasized over here, because our patients, whosoever comes or walks into any doctor's room, they come with a lot of, thoughts. They have a lot of trepidation, stress, anxiety. What's doctor's gonna tell me, what is expectancy about, what are the issues related to the treatment, how long I'm going to survive, what's going to happen to my family, and these are quite relevant and important questions. And when it happens to that particular individual, these patients need immense empathy, immense psychological support, immense family support to really, tide away through the situation. And these are the time to hold hands of the patient, to carry them through all those initial stressful times as the patient embarks on the treatment. So that is how, as a doctor, we normally look into that. So I think you raised quite an important point here. That is something which we don't discuss more often. And at times we are also guilty to the party that, we sometimes as a doctors, our focus remains on improving the survival of the patient or improving the, cure rates of the patient. And in the bigger scheme of the things, this area at times can get slightly neglected. But, patient counseling is quite important. These patients have a lot of questions. Now, the questions are not only related to the disease, it's related to the stage, it's related to the cure rates, it related to the therapeutics, it relates to the adverse effects of therapeutics. What if the cancer recurs? What are the options I have? Now, many a times our patients do read a lot on Google and come to us and they have some questions. You are answerable to them because that is how the life works for even for doctors. And then again, we have to dispel some of the myths what they are coming with. And I think at the end of the day, if the doctor, in the patient, and caretakers, they are all on the similar page, understanding, this patient actually do extremely well, not only in a therapeutic way, I would say, but also their emotional needs, their psychological needs are taken care of. There are times when the patient actually goes into some kind of more like a depression like issues, where a psychologist help kicks in, where the psychiatrist at times we may require some pharmacotherapy. so as to ensure that the patient's mood remains, much more motivated during these hard times, and that also helps our patients. So I think it's a more, I would say, a holistic way of treating the patient, not only the therapy but also the counseling and also the support, which includes emotional and psychological support.
Dr. Nikhil, that is very true. It has to be a mix of, for that holistic journey, treatment journey. Coming to, since you talked about the myths and misconceptions also. So in your practice, what are some of the, because I've also heard a lot of time people saying, okay, well, if we go for biopsy, it might, the cancer might, go to other parts of the, and there are a lot of myths related. So in your practice as an oncologist, what are some of those myths that you've heard from your patients? And because that would be really helpful to our viewers who are, there to know more about lung cancer.
So I think you already, already put forward the first one, that the cancer spread after the biopsy. And I would tell you, this is one of the commonest, I would say, the questions patients ask. Doctor, please treat me without a biopsy. And that remains a challenge because science tells us to do the biopsy, and it's often discussed by many patients. I have seen some patients who actually don't come back, and they go for some alternative therapies just because they don't want a biopsy. That is quite unfortunate. But again, I must reiterate over here that the biopsy for lung cancer is not something which makes it spread or metastasize, so that doesn't happen. So be rest assured, these are normal standard recommendations globally. Whether you go to any Western world, also without biopsy, the doctors don't treat you. So these are quite a normal myth what we often come across. Another myth, what sometimes the patients or relative feel, that if I don't smoke, I won't get lung cancer. No, that is not the truth. We do come across quite a few patients in the recent times, especially we are seeing a lot of women also who had never ever smoked in their life, still getting cancer. So smoking is equal to cancer is not the equation. Yes, smokers have higher probability of getting cancer, lung cancer, for that reason. But even non-smokers can also get cancer. So that is one of the important myths what we often come across. At times, there is some suggestion in the society which tells us that, oh, this guy probably deserved it because he was a smoker, and this is something, it had to happen to him. Now, instead of having such a judgmental perspective about the patient, or that this is probably was his karma or something, I think that is not the way to probably, look into that. I think one has to be extremely empathetic, because that's a myth that this is what expected to happen for the patient. So that is not the way to handle those patients, or for that matter, your any colleagues, friends, or whosoever it is. So that is another thing. In general, there is always a myth that the lung cancer is usually not curable and survival is extremely short. Now, that is one of the biggest myths what we come across. Again, like happens with most of the early stage cancers, even the lung cancer in the early stage is highly curable. When I joined my initial studies for oncology, we were told that on an average survival of most of the patients would be remaining somewhere in the range of a year or so for advanced stage cancer patients. In today's date, we are seeing more than 25-30% despite being stage 4, crossing 5 years. So that's quite significant numbers, and this is just we have to give it to the science. The science has evolved so much that our patients are surviving longer. And many times patients feel that, okay, it's anyways advanced stage, why treat the patient? But when the patient gets a meaningful life, longer life, in an extremely high quality life, so these are a typical, myths what we come across for the patient. And in general, another myth is that most of the people feel that, oh, lung cancer patient have to be extremely sick. But honestly, these patients actually are, especially with the advent of newer treatments like targets and immunos, these patients are almost asymptomatic. They actually can move around in the society like nothing has happened. They attend all the functions, marriages, offices, work, everything. So these are kind of often we come across certain myths that and we have to we continue to really dispel those myths whenever it is possible, as as that is probably our job.
That is extremely important, and that is why, we are both of us are here to talk about the important issues. And coming to the last part of the discussion, if you were to give an advice to a normal person for awareness creation, around awareness, early diagnosis, because we Indians do not prioritize health. That is a really sad reality. What would it be? What
So
advice do you get?
yeah. So I think awareness is something I think both of us are trying to do our bit of awareness through this discussion, and that is something I'm sure those the listeners who probably would have some take home messages in the entire discussion. I'm sure about it. But as I mentioned previously, one is about the lifestyle, second is about your habits. So we discussed at length about smoking, passive smoking. So this is something what I am sure government is doing their own bit by by their various campaigns. By even if you look at the pack of a cigarette, you might see the display picture should be at least 70-80% of the entire box. So that kind of awareness I think everybody is doing, and so that I think as stakeholders it is our responsibility also to take it forward. So first and foremost is about lifestyle modification, quitting bad habits like smoking, staying away from passive smoking. For that reason, try and understand, are we at risk of getting lung cancer through exposure, like as I mentioned about certain asbestos exposure or certain glass factories or cement factories. So these are the people who might be at higher risk of getting a cancer, so one can actually get themselves regularly checked over here. There has been a screening which has been recommended by more from the Western world. You can say about USA, where they talk a lot about LDCT or low dose CT scans. Now these are recommended for the people who are high. I would say, let us put it this way: they are like a heavy smokers. There is a definition for that. I think I don't want to go into that. But whosoever is a heavy smoker crossing certain age, more than 50, 55 years of age, they do recommend these low dose CT scans to pick up the cancer in a very early stage. And there you can actually make a difference, because early stage cancers, when they are picked through a screening technique, the possibility of cure increases quite substantially. So that is another way I think one can look at. Having said that, it is not something which is routinely would be practiced in India for now, because India has their own other health burdens which are prime foci for now. And but yes, opportunistic screening is something what as a doctors would recommend. If you come across certain heavy smoker, we do discuss with them, okay, probably you might undergo this particular test, and no, keep be under close observation under a pulmonologist care and or under an oncologist care or a physician's care, so that no, they can be safeguarded. And even if you quit smoking, it doesn't mean that your cancer risk comes down immediately. It takes few years before the cancer risk starts plummeting a bit. But having said that, even those people also probably need a bit of understanding about what screening is all about, and there can be one in the informed decisions can be taken, and especially with the dialogue with the treating doctor. So these are certain aspects of it. When you talk about awareness, you talk about lifestyles, you talk about habits, and you talk about screening over here.
Dr. Nikhil, that indeed was a very interesting session, and I'm sure because in such simple terms you have spoken about all the important risk factors, medical interventions, treatment options, and I'm sure our audience will take a plethora of information on lung cancer, which will be very beneficial for them. And thanks for taking out time from your busy schedule and joining us today for this very imperative discussion. And thanks for being with us.
So thank you so much for the opportunity. Now the World Cancer Day is around the corner. Again, it's again onus lies on us as an oncologist community to spread a word and spread a word in the right way so that as a society we all get benefited. So this was an attempt. I'm sure I really congratulate you for making it happen, and I'm sure I think we could answer, rather I could answer some of the important questions.
Yes, of course, it was a
And
very
thanks for eliciting the right questions in this regard. Thank you so
Thank you.
much.
Thank you, Dr. Nikhil. And that's all for today, everyone. We will see you again in another important discussion on a critical health issue. Meanwhile, please keep on following our social media pages for more updated information on health. That is all for today.
Thank you so much.